For our Cultural Encounter project, we decided to learn more about the homeless population of Dallas, as we felt that they are often overlooked when considering minority populations. To learn more about the homeless population and the challenges that they face, we visited a shelter known as Dallas Life.
Homelessness is an issue that our society has faced for many decades. Recently, however, there has been an increase in the population due to various economic factors, including the housing crisis. Low wages coupled with no affordable housing available have led to foreclosures and evictions. However, there are many other paths that can lead to homelessness. The biggest causative factors include defaulting on healthcare bills, domestic violence, mental health issues, and addiction. Currently in the U.S., there are 554,000 members of the homeless population that range from all ages and backgrounds. Texas is one of the 5 states that are home to more than half of the country's homeless population, which makes this a very pressing issue to our community.
Facing the entrance, the front porch of the Dallas Life Shelter is used as a waiting area for new applicants as they wait for a criminal background check to process. This is typically a full-day waiting process, and with the new remodeling set to begin this upcoming year, the shelter plans to cover and environmentally control this waiting area.
In order to gain a deeper insight into the population, we got into contact with Mrs. Gracie Leveridge, the Director of Public Relations and Donations at Dallas Life. She's been working at Dallas Life for approximately 10 years, since 2008, where she started as a volunteer under her father, who was the director of the program. Now, she oversees fundraising events, media, public relations, digital marketing, and relations with donors. In regards to the general demographics, the shelter serves both men and women in addition to families. About 50% of the residents are white, 30% are African American, and about 60 to 80% are mentally ill. A lot of the residents include children who live with their families in one of the 50 family rooms and commute to school by bus every morning in collaboration with the Dallas Independent School District. Children are provided school uniforms, school supplies, mentoring, and tutoring by volunteers, and in addition, infants and toddlers are provided diapers, wipes, clothes, bottles, strollers, toys, and books, among other supplies. Typically, residents of the program stay for about 12 to 14 months on average and must adhere to strict requirements of drug testing, adherence to patient medications, house rules, mentor meetings, chapel service attendance, and participation. If any resident quits or takes a hiatus from the program for any reason, they cannot rejoin the program for 30 days. If a member breaks any rules while in the program, they are subjected to 30, 60, or 90-day suspension. One aspect of homelessness that Gracie was keen to touch upon was the misunderstanding of homelessness itself. The general consensus image of homelessness is someone who stands on the street corner begging for donations. However, in actuality, yes, that does exist. But the vast majority of homeless are people caught in a bad situation and are actively trying to dig themselves out, or they're mentally ill. The greatest challenge homeless people face, Gracie explained, is some individuals' lack of motivation to recover. This program extrapolates on the ambition of the individuals who are ready to make change in their lives. Dallas Life's New Life program works with these individuals and has been able to graduate on average more than 30 individuals per year since 2007.
One of the amenities the shelter offers is an on-site clinic that provides routine health checkups, lab work, STD testing, TB tests, and dental services by licensed medical personnel. Dental service includes cleaning, filling, extraction, and even dentures. Other healthcare provisions include vision services such as vision screening and lens wear fittings.
Meal service is offered daily for all 3 meals. A typical meal consists of a few vegetable side dishes, main course, protein, dessert, and fruit. The shelter serves many people daily, but the assistance provided at this program isn't enough or accessible for all who need it. There are a few government assistance programs that members of this population can take advantage of, such as the McKinney-Vento Homeless Assistance Act of 1987. This act established the Interagency Council on the Homeless and created other programs using public funds and government resources. Our job is not just as pharmacists, but as an advocate for our patients. And in this role, it is our responsibility to consider our patients' lifestyle. Continuity of care is important to maintain after discharge or meeting with the provider. It is important for us to be able to point our patients to these resources or work hand in hand with social workers to make sure that they are taken care of even after leaving our facilities. As providers, we will encounter a variety of patients from so many different backgrounds. We should keep an open mind and do whatever it takes to facilitate the best health possible for our patients.